And welcome back to part 2 of episode 1 in our Extraordinary Egg series. We are now diving into the uncracked potential of eggs to combat malnutrition in LMIC. So in the first part of the episode, we delved into the rich nutritional profile of eggs, and now we're going to explore how eggs can be a key player in places where malnutrition is most prevalent. So we're delighted to continue this discussion with Dr. Laura Iannotti and Dr. Nelly Zavaleta. And now, without further delay, let's dive into the role of eggs and the role that they could play in alleviating malnutrition in LMIC. So I'll start with you again, Laura. We know that regular consumption of eggs contributes significantly to improvements in child growth and cognition, while also improving dietary diversity. And I know that you've led many RCTs exploring the impact of eggs on child growth. Can you share why eggs stood out as a choice for you in these interventions, and which particular nutrients in eggs are crucial for child's growth and cognition? And I know that you've mentioned some of that earlier on, but if you could expand, that'd be wonderful.
Sure. So my lab focuses on sort of the broader food group category of animal source foods, because animal source foods contain these bioavailable nutrients that vulnerable populations, children in particular, can absorb and metabolize more efficiently than plant-based foods. Eggs have been one of our foods of choice because, as Nelly mentioned earlier, eggs tend to be more affordable than compared to other animal source foods. So people can access them, especially in very low income communities. This is an important element. But what we do before we do these trials is we conduct formative research to also see if there's a cultural acceptance, if there are norms around consumption of eggs. And we found that to be the case in Ecuador, where we did the trial, the successful trial on child growth. People consume eggs already. They're highly valued. They can afford them. So these are all part of that decision-making around which of the animal source foods we want to consider in our work.
Dr. Nelly, Dr. Laura's research underscores the nutritional value of eggs, especially for young children in LMIC. And so they seem to be a solid choice for complementary feeding. But again, there's been some debate. So past guidelines hesitated to introduce eggs before 8 or even 12 months of age. So are these claims well-founded, according to you?
Before going to that part, I would like to stress the importance of the eggs in complementary feeding, because usually children in developing countries decreases growth velocity approximately at 6 months of age at the moment of complementary feeding. Growth velocity decreases, and by 2 years of age, there is diminish in stature in children. So this is related. And then so many children can be stunted, and there is evidence that stunted children has less development. So part of this potential of development has lost. So in studies of cohort, it has shown the relationship of chronic malnutrition with development and with quality of life in the future. So it is very important to prevent this decrease in growth velocity that leads to chronic malnutrition. And what we show also that in children, the problem is the quality of the diet. The quality of the diet that is limited during the complementary period, the needs of nutrients are very high because of the high velocity of growth, and the diet is poor in some vitamins and some minerals and some fatty acids. So the quality of the diet is one of the main causes that leads to chronic malnutrition. And in this regard, eggs is a perfect food that is affordable for families that can help to close the gap between the recommendations and the needs of the growing children. And then I can tell you about the allergies. The problem in infancy, but it's a rare problem. I would say that approximately 1% of children might be allergic, but it's not very common, and usually can be easily recognized by the doctors and prevented. But many of the children outgrow this allergy during adolescent period. Thank you.
Laura, I see you want to come in here.
Yes, I want to add to what Nelly has said about allergies, because we also, in addition to cholesterol, we find that is another concern that people express with regards to introducing it early in a child's life, is the concerns about allergies. First of all, in all of my studies in many, many low and middle income countries, we have never seen egg allergies. We're always prepared for it. We have our EpiPen, we monitor it for egg allergies, but we've never seen this. And in fact, in Ecuador, we tested blood for an immunoglobulin called IgE, which can indicate egg allergies, and we found very low levels in this population. But the more important point I want to make is that the American Academy of Pediatrics is no longer, counter-indicating or not recommending the introduction of eggs because they're not going to cause an allergy. And in fact, they might reduce the risk of it by introducing it early. So it's a really important point to keep emphasizing that introducing eggs is not going to cause allergy. And we don't want to deny so many hundreds of thousands of millions of kids the good nutrition of eggs for fear of cholesterol or allergies because the evidence doesn't support it.
Yeah, absolutely.
Thank you both. I think it's really great that you're both underlining this because you're right. There's been a lot of misunderstandings around this whole allergy domain. So we've talked a bit about the complementary feeding space, but I also wonder, Dr. Nelly, perhaps, eggs are also noted for being beneficial during pregnancy and lactation. So can you tell us about the benefits of eating eggs during those times and how they specifically help the mother and the baby?
During pregnancy, the needs for the growing fetus are very high. And also the diet of pregnant women also is deficient in many minerals and vitamins and fatty acids. So eggs are the perfect food source of this nutrient that can help to have a baby that is born at term with adequate weight. So it's important for an adequate growth and also for preventing premature and also for adequate development, because during this period also it is important development, and the egg is a good source of fatty acids, it's a good source of choline, and it's a good source of zinc also, which is important for healthy pregnancy.
Wonderful. Thank you so much to both of you for laying this out so clearly for us. So before we move on, I suggest that we hear from Jordy, and Jordy will share our number of the day. Take it away, Jordy.
Thanks, Casso. So we've heard about the nutritional value of eggs and the potential for eggs to prevent malnutrition in children, particularly in LMICs. However, I'm curious as to what is the actual prevalence of egg consumption in children around the world. So today's number of the day is 17. The global UNICEF databases say 17% of children between the ages of 6 and 23 months from the lowest quintile consume eggs, compared to 30% of children in the wealthiest quintile. So I wonder, does this difference in egg consumption prevalence point to a challenge or an opportunity for eggs' potential to alleviate malnutrition in children? Laura, in light of your work, do you have any insights in this area?
I'm so glad that you've raised this point, Jordy. I think that when we talk about, healthy, sustainable dietary patterns around the world, we need to also talk about the principle of equity. I think one of the large issues, one of the most critical issues that we're facing around the world in terms of malnutrition, and even, I'll bring in climate change and the environmental impacts of food systems, is this issue of equity. As you say, in very low income settings, people have low consumption of eggs, whereas in high income, we have a very different scenario and high intake. So really what this comes down to is thinking about redistribution and making sure that vulnerable populations have access to these foods, not just eggs, but other animal source foods. So it's a principle of equity, and I'm really glad that you're highlighting that as your number of the day.
I think what you just shared is so important, Laura, and I'm glad you mentioned the importance of making eggs basically accessible, affordable, and appealing. And it's true that at Sight and Life, we've been on this mission now for many years, and this was in part to the huge opportunity that was screaming at us when we saw the huge benefits through the trial. So I fully agree with you on that. Nelly, would you perhaps like to comment?
Yes. I would like to emphasize the perception of mothers regarding eggs. So mothers recognize eggs as a good, nutritious food for their children and for their family. And among the list of animal food sources, I would say that eggs are the more affordable. So there is still possibilities to increase consumption even in the people with less income. Yeah, if we inform more and we emphasize the importance of eggs as a nutritional food source, I think that can be improved. So there are several ways we can improve the consumption of eggs products in the communities, even in the poor settings.
Thank you, Nelly. And by the way, to our listeners, we will have a whole episode on that in our second episode. So you'll have more information from us on that. And I believe Matilda now has some interesting news to share with us for our newscast. Take it away, Matilda.
Yes, thanks, Kesso. So, in April 2023, the FAO released a report looking at the contribution of terrestrial animal source food to healthy diets for improved nutrition and health outcomes. They stated, terrestrial animal source food within healthy dietary patterns can make vital contribution to efforts to meet the global nutrition targets for 2030 endorsed by the World Health Assembly and the SDGs. These global nutrition targets aim to reduce stunting, but also overweight among children under 5, low birth weight, anemia in women of reproductive age, and obesity, as well as diet-related non-communicable diseases in adults. So Dr. Nelly, knowing the potential role of these terrestrial animal source foods to meet these nutrition targets, how can we ensure that communities in low resource settings have continuous access to these foods in a more affordable and sustainable way?
I would say that the terrestrial animal food sources provide a high quality protein, and they have a unique amino acid and complete amino acid patterns. Also, they contain bioactive factors that help to prevent diseases. So also, as Laura mentioned, these animal food sources also have essential fatty acids that are important for neurodevelopment, especially for cognition. So among the group of TASF, the consumption of eggs products are accessible, affordable, and also thinking about the carbon printing and the climate change or production of egg products feasible, accessible, and I think that can be recommended, and I think that it has a good possibility for people living in poor conditions to have access to good quality food source with eggs. And among the list of animal food sources, eggs are, I would say, the more affordable.
Laura, would you like to add to that?
Yeah, I just want to underscore what Dr. Nelly has said. I think the point that eggs can help us move closer to the Sustainable Development Goals, which was part of the messaging in the terrestrial animal source food report from FAO. That's really important, not just related to human health, but also related to other SDGs, so that we can use eggs as a sustainable source, a renewable source in many ways of animal source foods as a category, and also for diversifying diets. And diverse diets relates to biodiversity in our environment. So there are a lot of benefits that we can see coming out of eggs and consuming eggs. Now, I do think eggs alone are not going to solve malnutrition. We know that it's really about diversity and moderation, but eggs are certainly an integral part of that. I think I've answered the question, Kissa, but I'm not sure. So please elaborate if you want.
No, you definitely have. Thank you so much. But we are approaching the end of this episode already. I have a final question for both of you. So to inspire our Brain Food podcast listeners to engage in more research, could you perhaps share some of the current gaps in science or implementation concerning eggs and nutrition? Nelly, perhaps you can start.
We have to think about how to make affordable eggs, especially in particular to people that live in food insecurity. Because food insecurity nowadays, after the pandemic, has increased in many countries. And in particular, the quality of the diet has been affected. And it's very important to diversify the diets and to think about those animal food sources that are cheapest and are friendly with the environment. So this is not an easy task, but I think that working with organization of women might be a possibility to make accessible and feasible to diversify the diets. Of course, with egg products and also other food groups like vegetables and fruits. So I will say to emphasize in supporting this kind of work with community organizations.
How about you, Laura?
I would say there are two streams of research that are now needed to move this science forward in terms of the nutritional importance of eggs. The first is in the category in global public health nutrition that we call nutrition-sensitive interventions. And that is exactly what Nellie is talking about, which is how do we make them more affordable, more accessible, more available? So essentially, egg production at smaller scales that might be improving accessibility in markets, or poverty alleviation so that people can afford eggs in very low resource setting. Those are examples. The second stream of research that I would highly recommend, because there are significant gaps in the evidence base, would be for different phases of the life course. So Nellie and I have been emphasizing the first 1,000 days of life because of all of the reasons she described, which is the velocity of growth, the importance of brain growth in that period. But I sometimes think we neglect other phases. We should be paying attention to them. So the school-age child is one example. Brain development continues, through adolescence, even into the 20s. And actually, the good news is we keep changing the brain even as we age. And eggs can be an important part of the diet for school-age kids, but we don't have very much evidence there. And then the second life course phase where I feel it's been significantly neglected and the demographics of our globe are changing is our older adults. So we know that meat, for example, can prevent sarcopenia or can improve memory, but we don't know much about eggs. So what are the possibilities of eggs for older adults and preserving health and protecting health in that period of the life course? So I'll end there.
Well, these are really fascinating insights, and I love what you're saying about school-age children. We at Site and Life, we focus more on adolescents, but it's true that there is this growth spurts. So it would be the perfect timing to include this as part of their diet. So hopefully more research in this space. And just like that, we've reached the end of another episode of Brain Food. So a big, big thank you to all our listeners for joining us in the kickoff of our series, Extraordinary Eggs, brought to you by Site and Life. A huge shout out to our wonderful speakers, Dr. Laura Iannotti and Dr. Nellie Zavaleta, for sharing your expertise. Your insights have been incredible. A heartfelt thank you. And a warm thank you as well to my co-hosts, so Jordi and Matilda. It's always a pleasure to explore these topics with you. And a big thank you to the Site and Life team, particularly Jimena and Rachel, for all the work behind the scenes, really. And before we say goodbye, here are 3 takeaways. First of all, if you enjoyed our conversation today, make sure to follow Brain Food by Site and Life and share this episode with your friends, families, and colleagues. Please don't hesitate. And next, keep an eye out for our upcoming episode on the Egg Hub. So the Egg Hub is a fresh initiative to boost egg production. I see you guys are smiling there already. To boost the supply and the consumption of eggs in LMIC. And it's an episode you definitely do not want to miss. And finally, have a look at Site and Life's latest special report called The Promise and Progress of Maternal Nutrition in India. And it's available on our website, so do have a look. And this wraps up our show. So we hope you have a wonderful time wherever you are. Stay connected with us on Site and Life's social media channels, and we will catch you in the next episode. See you soon, everyone.
Thank you. What my pleasure. Bye-bye.
Thank you, Kessim.